It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show. It is Expresso right here on SABC3. We're talking health this morning and flu vaccinations. If you have a question for our expert, you can give us a call on 083 913 3728. Thank you so much to our callers that have already called in. Dr. Angela, let's talk about childhood vaccinations. Now, I've heard a lot of people talking about the fact that it's wrong to vaccinate babies. Is this true?
Absolutely not. Vaccinating your baby is the best possible gift you can give your child. Okay. It protects against many, many diseases which are entirely preventable through vaccination. And we know that vaccines save the lives of about 3 million people, including children, each year. Okay. And the biggest killer of children in South Africa is pneumonia and diarrheal disease. And South Africa, in fact, is the first country in Africa that rolled out both the rotavirus vaccine for diarrhea and the pneumococcal conjugate vaccine for pneumonia. And these have been hugely effective in preventing serious disease and death in children in South Africa.
So when is the earliest time in a child's life that you can start doing the whole flu vaccination?
Right, so flu vaccine is only indicated for children from the age of 6 months. It's only licensed from 6 months. But what you can do to protect a child who cannot yet be vaccinated is to vaccinate all the significant people who care for them. Parents, grandparents, siblings, caregivers in the home. And in that way, you will kind of cocoon the child and prevent transmission of flu to them.
Wonderful. Let's talk about other target groups as well. So you said that it's very, very important to do it from 6 months old.
Yes.
Childhood vaccinations is very important, but other target groups as well. Who are we looking at?
So the field of vaccination is really dynamic and exciting. There are new vaccines coming online all the time, and we're also expanding the groups of people eligible for vaccination. So previously people thought it was just children. Certainly now, maternal immunization is an exciting field in which we can actually passively protect children by vaccinating their mothers. And this is true for whooping cough, as well as for tetanus, as well as for influenza. Then healthcare workers are a hugely important group to vaccinate, not only for their own health, but to prevent them from transmitting infection to their patients. And then lastly, adolescents. We now know South Africa is using the human papillomavirus vaccine, which will hopefully bring down the rates of cervical cancer, a really important cancer in women in South Africa.
Okay, wonderful. Now, there's also one question that I forgot to ask you. What kind of vaccinations should be a staple for young children?
Sure. So the South African public sector uses a schedule called the EPI, the Expanded Program for Immunization. So every mother gets issued a Road to Health card at the child's birth. And if you receive all of the indicated vaccinations, you'll be protected against 11 deadly diseases that could literally kill your child. In the private sector, there are 4 additional vaccinations that are added: hepatitis A, mumps, rubella, and chickenpox vaccine.
Now, also, I wanted to ask you that one of our callers earlier on mentioned that they were allergic to antibiotics.
Right.
Is there antibiotics in a flu vaccine? And is it okay for them to then still receive the vaccine if they are allergic to antibiotics?
Yeah, so there is no antibiotic content in the vaccine itself.
Okay.
And certainly there are really very, very few reasons that people could not be vaccinated. One is severe egg allergy, but that's exceedingly uncommon.
Yeah.
But certainly you would always discuss it with your provider or the pharmacist administering the vaccine.
Well, what I also wanted to know is we have, or I have at the radio station where I work, quite a few pregnant colleagues.
Yes.
Does the vaccine affect pregnant women? Is it okay for them to be taking it? I think you touched on that a bit earlier on.
So flu vaccine is safe for pregnant women, and in fact, studies from Professor Shabir Mahdi here in South Africa have recently shown that flu vaccine can reduce infection not only in the mothers themselves, but in their babies in the first flu season after they've been born. And this is particularly so for HIV-infected women. So it's really crucial to receive flu vaccine if you're pregnant.
Anything else that you would want our viewers who are sitting at home right now, who maybe have missed any part of this? One of the most important things that people should remember when it comes to flu vaccinations, especially around this time of year. Anything else you think we should be sharing with them?
I just think that it's absolutely important to be vaccinated, particularly if you're in one of those high-risk groups that I mentioned before. You need to get it as soon as possible before the flu season starts. Remember, it's not 100% effective, but it will reduce your chances of getting severely ill or hospitalized. And we know that vaccination is the most effective public health strategy ever known to mankind, even better than antibiotics. And the beauty is it prevents you from becoming infected rather than curing you once you have disease.
Absolutely. Dr. Angela Dramowski, our health expert this morning, talking about all things flu vaccinations. Thank you so much for joining us on our show this morning. And let's head over to the crew outside. Of course, we'll see you same time, same place tomorrow morning. Mwah.